Good afternoon, everybody. We're so happy to have you both and those on Zoom. You're here for Investing Now in Your Health, Strategies for Living Longer and Feeling Better. And to introduce the man who will be speaking to you, Dr. Edward Markowitz. He is a certified member of the Foundation for Wellness Professionals and a diplomat in occupational health care. Since 1979, he has been the Clinical Director of Advanced Wellness and Injury Centers. Dr. Markowitz has nearly 40 years clinical experience treating over 15,000 patients and frequently consults many corporations on ergonomics, wellness, and the prevention and treatment of work-related injuries. In addition, Dr. Markowitz lectures on the topics of digestive problems, stress management, natural solutions to type 2 diabetes, sleep disorders, male and female hormonal problems, sports and work injury treatment and prevention, and holistic healthcare. Dr. Markowitz has also been a member of the Spinal Surgery Committee at Danbury Hospital and has completed a postgraduate program for a certification as a Functional Medicine Practitioner and a diplomat degree by the American Board of Clinical Nutrition. Dr. Markowitz also has completed a certification in Oriental Medicine and Acupuncture. So now, here's the man himself.
Thank you, Jillian. Here you go. You can hold on to this. Thank you for coming out today. It's nice to see you. And I'm going to speak to you very personally today. And if you have any questions, please don't hesitate to ask because we only have a few people. I'll be able to spend a little more time answering your questions specifically too. So I think there's nothing better than investing in your health. I think that, people invest in all sorts of things, but when it comes down to it, if you don't have your health, you really, the other things become much, much less important. So I'm going to teach you some things today, at least make you aware of what really controls our health and how you can have a lot of control over your health. I'm going to teach you some strategies, I call them, or methods to help you feel better and live longer and also more pain-free. Okay, you heard enough about me, so I'm going to just keep going. Dr. Rockenow is an associate of mine. She received her undergraduate degree from Skidmore College and her medical degree from Columbia University. She's board certified in family medicine and anti-aging medicine. So longevity and anti-aging go together. She's also an expert in that. I'm going to ask you something after I read this, but this is the mission statement of the office that I created over 40 years ago. And we haven't changed any words in it since then because we really thought about it a great deal. So we're a unique multidisciplinary team of professionals dedicated to providing high quality, effective treatment to reduce pain and suffering in a caring atmosphere. Our goal is to educate our patients, their families, and our community on how to sustain a lifetime of optimal health and wellness while limiting the need for drugs and surgery. So every word in that mission statement is pretty important, but I like to always hear what my audience thinks is important. So if I was to ask either of you, what do you think is most important to you? And you win a prize if you give me any kind of an answer.
Question?
Of all of the things that I just read from this mission statement, what words are the most important to you? Yeah, well, is there any particular words that you think were pretty important? Well, a lot of times I get a few pretty typical answers. I'll give you some clues. Okay, so one is educating patients. That's what you're here for. Also, I educate my patients, their families, the community. You're part of this community here, and I'm really somebody who's dedicated to giving community education on health and how you can really be healthier if you know what to do. And so I want to give people information about that. Another thing is people usually say that they'd like to limit the need for drugs and surgery. Are either of you on any medications? Lots of medications. Would you like to limit your need for those medications? You need them. Okay, some people do, and I never take anybody off of medication. Their doctor gave them those medications. He and you would have to decide. But sometimes I get people healthy enough where they don't need them.
I never know.
All of a sudden it became necessary. Yeah. Okay, well, maybe I'll ask you a little bit about that privately later. Yeah. What were you going to say? What?
Yeah.
Yeah. Well, I'll again, maybe after the talk today, you'll see that you probably could at least learn something to how to control your. Okay. Yeah, it'll be until 3. We'll get you out of here. Okay. Oh, okay. Okay. So you filled out this survey. How many of you checked off something on that survey? Did you check off anything? Okay. How about anybody check off at least one thing? 2? 3? Okay. I don't want to embarrass anybody, but okay. But every one of these symptoms or conditions are things that I help people with, but also it's a sign of your body telling you that there's something wrong. And, I always take a look at that because, if you were doing everything right, our bodies were designed to be healthy. And so there's a reason why you're having these symptoms, and you got to do something, maybe besides medication or in addition to medication, to actually make yourself as healthy as possible. So think about this. You guys don't drive? You drive? You do? Okay. Well, what? You don't have a car, but maybe you did at one time?
Yes.
Yeah. Okay. Well, when you had a car, did it have an engine light that went on ever? Did it ever have a light on it inside on the dashboard? Okay. So the engine light on your car is kind of what happens when you start feeling some sort of a symptom, something that your body is telling you something is wrong. And that's what the engine lights and the lights on the car do also. They tell you when something's wrong. And so it's a warning that something's wrong. There's no such thing as a normal symptom. A symptom is something either you feel or complain about to your doctor or a friend, something that you just feel isn't right. And so you would check your car to make sure it didn't get worse. I think your body deserves at least the same attention that you give your car or when you had one. So taking care of your body is even more important than your car. And some people treat their bodies like if an engine light goes on, they want to cover it up. They don't really want to get rid of the cause of it, or they don't know how. So what I'm going to talk to you about is getting rid of the causes of problems, not just covering things up. So you have 2 choices regarding your health. You can do the same things you're currently doing, getting the same results. If you keep doing the same things, you get the same results. If you do something different, you try something new, something different, you can get a different result, and the choice is up to you. So maybe after talking today and listening to what I tell you, you'll start to think about doing something different. If I could show you today how to live longer and feel better at the same time, because people don't just want to live longer, they want to actually feel good as long as they're alive. So you want to do something natural and affordable. Would you do it if I could teach you some things that would help you live longer and feel better? Raise your. Who wouldn't? That's right. That's a good answer. Who wouldn't? Makes sense. And what do you think? Would you do something? Yeah. Okay. Good. We got a logical group here. Okay. What's that? So it's all about you. Learn how to control your health naturally. That's what I teach people. That's what I help people with. I help people control their health naturally with a minimum, or at least not needing as much medication as they probably would be given if they didn't have choices. So this presentation is for you if you're feeling overwhelmed and exhausted. Anybody feeling overwhelmed and exhausted? Overwhelmed sometimes. If you're not feeling as good as you know you should, does anybody feel well, Not necessarily, but a lot of people. Everybody you know, huh? Okay, well, then this is something that they should be here. The people who are feeling not as good as they should, they know they should. And you know you've got to do things differently, but you're not sure how to do it. Does that maybe describe you also? Maybe you need, maybe I should do some things a little bit differently about my health, but I'm not sure how to do it. No? Doesn't apply to you? Okay. Okay. Well, this is pretty staggering. It's a staggering fact that in modern medicine, roughly 80% of all chronic diseases are considered preventable through simple lifestyle changes. So we'll talk about what those conditions are and what some of the things are that you can do. So we're looking at heart disease, diabetes, certain cancers. The numbers show that our daily choices, what we eat, how we move, how much we move, and what we avoid often outweigh. People are told sometimes that, it's in their families, it's genetic, but what we do is even much more important. How we take care of ourselves is more important than the genes that we're given. So type 2 diabetes, the estimate is that 90% of people could actually prevent that condition. Either of you have pre-diabetes or diabetes? Yes. So it's a very, very preventable condition if you do the right things. You just got diagnosed. That's a good thing that you just got diagnosed, because when people have it for a while, it becomes more difficult. So I want to talk to you a little bit more about it. Type 2 diabetes is a very preventable condition. Heart disease, even though it's the #1 killer in our country, is also very, very preventable. And the things that really make the biggest difference are diet and exercise. So that tells you what the factors are that can make a difference. Stroke, also 80% preventable. It's really your blood pressure control, diet, and avoiding tobacco are very big factors for helping with that. And cancer, 40 to 50% is preventable if we limit alcohol use and tobacco use, if we get our weight down to an ideal weight, we avoid the toxic things in our environment as much as possible. And even ultraviolet light, the sunlight, is really one thing that really promotes skin cancer quite a bit. So avoiding that too. So this is just showing you that the diseases that are the most chronic and that cause the most trouble in our country, we're just not treating them by getting rid of the cause. We're covering things up instead, and that's not getting rid of the problem. Who wants to live to 100 years? Not you. How about you? No. How about if you were really, really feeling good at 100 years? How about? That'd be okay. So that's really the big factor. You don't want to live to be 100 if you're not feeling okay, if you're, in a wheelchair or in a home where you have to be taken care of, or your family has to take care of you. You want to stay as healthy for as long as possible. So it's not the years, it's how healthy you are for as long as possible. So this is really a statement. It says when it comes to longevity, that means how long you live. The goal isn't just to live as long as possible. The true objective or goal is to live as vibrantly and energetically for as long as possible. That's what your goal should be. I want to live longer, but I want to live well. I want to feel good. I want to be able to do as much as I can, as much as I want to do. So there's something called real age. Biological age is how many is really more important than chronological. Chronological age means you were born in a certain year and now you're a certain age. That's your chronological age. Everybody understand that? You know what I mean? Let's say if you were born in 1900, well, that's a little too far back. If you were born in 1950, you'd be 76 years old now. That's your chronological age. But I've had patients who are 76 years old, and they're like 66-year-old. And I've had 76-year-olds who are like 80. What's that?
100-year-old, like, pretty sure that would be me, but
Yeah.
it's amazing. They're like,
Yeah,
good shape too.
they're in good shape too. There are some certain places in the world called the blue zones. I don't know if you've ever heard of those, but there's 5 areas in the world where there are more 100-year-olds. Yeah, and the more 100-year-olds, and they live healthier than our 80-year-olds. So you have to understand it has to do with it has to do with what you do during your lifetime. That controls your health tremendously. And it's never too late. So don't think it's too late now. Okay. I gave you a questionnaire that you can look at also, and it will tell you whether you are older than your chronological age or younger than your chronological age. And it depends on certain habits that you have or certain things you do or don't do. Okay, so this is the state of American health. This is what's happening in our country. More medication is prescribed and surgery done than ever before. Our longevity, the length of time that we live, is 26th in the world. We spend more money. We have the most wonderful doctors and hospitals and medications. Why do you think that's the case? And we're still 25 other countries live longer than us. Why? Ask yourself, after what I've told you already, why? Well, too many drugs is one reason, and also not getting rid of the cause of a problem. Drugs don't get rid of the cause. What's that? Some, no, I'm not saying everything. Yeah, yeah, some conditions are more troublesome than others, but I would say there's lots of things that can be helped. And so if you're taking, yeah, some that can't. I agree. Some that can't. We're living a shorter lifespan for the first time in 20 years. Our lifestyle, stress, and diet are related to why we're living shorter lifespans. Disease care, not health care. That's really what kind of care that there is in this country. People go to the doctor when? When do you usually go if you're going to go to the doctor? What? Something's bothering you, some sort of condition or symptom that you're having. Instead of finding out, how can I get healthier so I don't have to go? How can I really talk to somebody who really knows how to keep me healthy instead of just going there when I'm sick? Very, very different. Two-thirds of our population is overweight, 1/3 is obese, which is severely overweight. And in 20 years, 1/3 of our population will be diabetic if we don't do something different. And it's not going to be another medication that's going to fix this. You have to do something different about your lifestyle, especially with diabetes. Okay. What are the reasons? We don't treat the causes of disease. We treat the symptoms. Disease care, not health care. Not enough money spent on prevention. There was an estimate that we spend out of $1. Let's say take $1. There's 100 pennies in $1. And we spend a half a penny out of every dollar on prevention. And if we spent twice that much, we would cut our disease down to half. Overall, doesn't mean every single disease, but all the diseases that are in our population could be cut in half just by spending twice as much on prevention. And there's a reason why we don't spend more money on prevention. What do you think it is? What do you think? I'll tell you in a little while. All right, you don't have to give me an answer now. So there's not enough education about improving your health, but I'm trying my best to give you some education today about improving your health. Changes in growing and producing food. Sugar intake has increased 300 times as much since 1900. Isn't that amazing? We used to eat half a pound of sugar on the average per day, and now it's really 1.5 pounds. So, I mean, it's really tremendously, per year. Half a pound a year, now it's 1.5 pounds per day. Tremendous amount. Extreme increase of toxins in, oh boy, I think I touched something. Oh, there we go. So there's an extreme increase in toxins, poisons, chemicals that are in our foods, that are in our soil, that are in the air, that are in our water. All of those things add up too. So we have to really be conscious of that also and try to minimize that as much as you can. You two, I'm talking to the two of you, are you frustrated by taking a pill for every illness? You are. So what I do is get to the cause of your problem and teach you how to really, really minimize your need for medication. Like what we said already, some medications are necessary, but if you do the right things, you can limit your need. Think about it like that. I'm not telling you to get rid of, throw them out. I'm telling you, how can you make yourself healthier so you don't need it as much? Wouldn't that be nice? Really? Okay. The greatest medicine of all is to teach people how not to need it. That's the kind of medicine that I practice. Okay. What is functional medicine? Well, that's the kind of medicine we're talking about. Our bodies were designed to be healthy. I'm a certified functional medicine practitioner. I was taught by the founder of functional medicine. He was one of my teachers, and that was over 40 years ago. And that's what inspired me to practice this way. Functional medicine is the science of creating health. It's the science of how to create healthy people. Traditional medicine, what most people are used to, is the science of treating disease. Side effect of creating health is decreasing and preventing disease and pain. So in other words, I'm trying to figure out why you have the condition, not what you have. If we figure out why, and if it's something that we can change, you can get better. Okay. Anybody ever feel like they're on a merry-go-round when they go to doctors? Like one doctor hands you off to another doctor? Yes? No? Not so much? No. Okay, some people tell me that. That's why I created this slide. You know, they say, oh, I go to the specialist in this. Yeah. Yeah, it's like a merry-go-round. They want you to be on all the different horses on the ride instead of just kind of, yeah. The ideal thing is to try and get off that ride. So, you know, you start maybe with your primary care provider or a specialist in one particular problem, but usually you are handed off to other doctors because nobody's giving you an answer that's, yeah. So what do they tell you when you ask why? They don't answer you. Yeah. Yeah, I don't think that's a good answer. I think you need to know why. I think you need to know why. And then there's something called alternative medicine, which is a whole other ride. And most people don't ever get on that ride, but they should, because it really provides removing the cause. It's got a different tool bag. The tool bag of traditional medicine is medication and surgery and procedures, and a different tool bag is removing the cause that makes people healthier. Okay. So traditional medicine, does this have a pointer on it, Danny? Oh, yeah. Okay. So traditional medicine, let's think about a tree. So the leaves of the tree are really all of the symptoms: digestive problems, hormone problems, pain problems, weight problems, anxiety, depression, fatigue. And most doctors will just spend their time looking at that, all of your symptoms. And instead, when they really should be focusing down here, where the roots of the problem are, underlying causes. Okay, because what we found now when we practice this healthy type of care, that lots of these problems go away all at once if you do the right things. And if you don't, then they need an individual medication for each one of them. And instead of treating each one of these things with a different medication, why don't we get to the cause and try to remove that? So I'm going to talk to you about what causes are. Let's talk about Medicare. Do you two have Medicare? Yes. So Medicare is also geared towards just giving people medication, or it pays for hospitalizations and surgeries and things like that. It doesn't pay for prevention. It really doesn't pay to keep people healthier. Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary by Medicare. Unfortunately, you are in this merry-go-round that just pays for the things that Medicare pays for, and you can't get out of that trap if you're waiting for Medicare to pay for it and you just don't do it. It's really not the best in your best interest. So, you know, I found that I can make ways to make care affordable, even for patients that have been on limited incomes and disability. And so I want to give people the care they need rather than wait for Medicare to pay for it, because they just don't. So I call this the health ladder. You know, sometimes everybody, maybe you haven't been on a ladder in a long time. Have you ever been on a ladder? Either of you? Years and years ago, maybe. Okay, but think about your health like a ladder. What's that? You don't have, it's a good idea not to have a ladder at a certain point. No, don't get off the ground really as much as possible. But this is just a make-believe ladder, but you can go from pain and disease all the way up to healthy and well by doing these things: healthy eating, improving your sleep, pain reduction, stress reduction, by having an ideal weight, and regular exercise. These are the steps to getting you to this. Understand that? Really important. Okay. And then you've got these things, which are bad habits: poor diet, minimal exercise, poor sleep, high stress, poor posture, excess weight, and they don't allow you to get up here. So the more of these things we take away and the more of these things we add, guess what? What do you think happens? You feel better. You're healthier. You don't have some of the symptoms that you have, and you don't need some of the medications as much. Excuse me, I'm going to just take a drink of water. A little tickle. Okay. So I'm going to cover 4 things that are the most important for how to live longer and really feel better and decrease your pain. 1, diet and nutrition. Food can be your best friend or your worst enemy. Just show a picture of, excuse me, picture of two or three people. The top picture, people eating fruits and vegetables and looking pretty happy and healthy. Here's some people having pizza and beer. What do they look like? They're not so good. And unfortunately, 60% of people's diet in this country consists of things like pizza and beer, and not enough things like that. So food can be your best medicine or your worst enemy. Lots of people don't know what to eat. What should I eat? It's so confusing, isn't it? You get confused about what? You don't think so? Okay. So tell me what you think the healthiest. And what else? Lean meats. Okay. Good choices. Really good. What do you think the worst foods are? Frying is one category. Yeah, frying and the kind of oils that you use are really, really important. There's olive is really the best. You know, any of those seed oils or vegetable oils, stay away from those. They're not good for you. They cause heart problems. They cause problems with your circulation. They cause cancer. Yeah, stay away from those. So what else do you think is not so healthy? What? Pizza. Okay. Why is pizza? You like pizza? Everybody, would eat pizza, but every now and then. Yeah, things that are made with sugar. Yeah, that's the whole list there. Yeah. So those are the things that really cause lots of our trouble. It wasn't around years ago. We weren't eating as much sugar, but it's so prevalent now. And then there are things that turn into sugar. What do you think those are? Yeah, foods that turn into sugar immediately, very quickly. Anything that's made with flour, especially, yeah, flour is the equivalent of sugar. It gets into your system even quicker. So if you are just diagnosed as diabetes, I want you to think about that, and really, really, you've got to start to look at wheat products as really something that's not good for any diabetic and not good for health in general. What's that? Oh, well, so wheat, sugar, really, really are 2 of the foods that really aren't good for us. And what? Well, it comes in cakes and cookies and pasta and things, so it's not breads. Those are the foods that really, yeah. And sometimes it's especially true the way we grow it and what we do to the wheat also in this country. So, okay, mental health is affected by food also. Harvard and Stanford, 2 of the best universities in our country, are studying the effects of insulin resistance. That means when you eat too many carbohydrates, refined carbohydrates, your body starts to not be able to use insulin as well as it did before. And so your gut, your digestive system and poor metabolism comes from eating sugar, starch, flour, and how that affects our brain. There was a study in Australia studying depression, found that eating real foods, you know what I mean by real foods? What do you think? What? Yeah, things that grow naturally, that grow on trees or grow in the ground. Those are real foods, and they only have one ingredient. Broccoli is broccoli, spinach is spinach. Those are the things that a fruit is a fruit, bananas, apples. They only have one ingredient. But when you start buying things that have lots of ingredients in them, they're not real. They're something that's been manufactured in a plant. There was a doctor actually named, and he was an expert trainer, Jack LaLanne. Anybody remember him? Years and years ago, I mean, he looked great and lived a long time. I think he was 99 when he passed away. He said, if it came from a plant, I don't eat it. If it's grown on a plant, I'll eat it. And so he just believed that the more you stay away from things that come from factories and are processed, you should be staying away from it. It shouldn't be the majority of your diet. It should be a very, very small part of your diet. We've seen that bad foods, especially the wheat and sugar foods, cause a lot of mood problems and depression and suicidal problems. But most of the time in this country, what's done about those things? Mood problems and depression and things like that. What? They send you to a therapist or give you some medication or both. But what you should do is food can be your best medicine or our worst enemy. And excuse me, I'm going to just fix your body first, and that will fix your brain, actually. So you want to fix your body. Are supplements necessary? Do you guys take any vitamin supplements? Okay, I think they are necessary. It's really important, the quality of the supplement and why you're taking certain supplements. So most people don't know what to get, or most people are buying stuff that's inexpensive. And I understand that too. Sometimes you have to try and save some money, but if it's not going to do you any good, it's not worth anything. And so you need somebody who's got experience dealing with supplements and which ones are going to work well for your particular problem. So how did you decide what vitamins or supplements to take? You just take a multivitamin, or do you take something else? Uh-huh. Yeah. 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 Well, I'll give you another hint. If it's on television, I'd stay away from it. Okay, because they spend so much money on advertising, they really don't spend enough money on the quality of the supplements. So what I say is you need a doctor with experience using food as medicine. If you don't have somebody like that, you're not going to really know what to take and if it's doing you any good. So sometimes we have to test. We do some blood tests, we do some other types of tests, saliva tests to figure out what vitamins are good for someone. And supplements, which vitamins and minerals, are not a substitute for healthy food. They're really, really a supplement. They're in addition to healthy food. Because if you're going to eat cakes, cookies, and ice cream and take a vitamin and think you're doing a good job, that doesn't work. Doesn't work. Hasn't worked for anybody I know. Okay. There's something called a secret killer. This article was written a long time ago, and it was in a very famous magazine called Time Magazine. And it's still around. You heard of it? And so what that article, it was 35 years ago, the link between inflammation, heart attacks, cancer, Alzheimer's, and other diseases. So inflammation is really, really one of these things that is linked to lots of diseases. If we can control inflammation, food is one of the biggest things that drives inflammation. So there's certain foods that are inflammatory and certain foods that are anti-inflammatory. All of these illnesses and symptoms and many more have commonly been helped by our functional medicine approach called the Restore Your Health program. Alzheimer's, asthma, stroke, cancer, chronic pain, type 2 diabetes, overweight and obesity, digestive problems, fatigue, insomnia, depression and anxiety, inflammatory bowel disease, and diseases where the immune system attacks the body, such as rheumatoid arthritis, lupus, or sclerosis. These are all conditions that I've helped people with this approach, not with medication. In addition to medication, sometimes people get so well they don't need medication. Pillar number 2, exercise. Do you guys do any regular exercise? Not anymore. You can't? Okay. Well, there's some things that maybe, the right person could teach you some things that you could do even with a problem like if you. Oh, okay. What was wrong? For what? Bunion or plantar fasciitis or neuroma? A neuroma? No. Oh, hammer toes? Hammer toes, yeah. Oh, how are you doing with those? Mm-hmm. Yeah. Well, there are substitutes yeah, that's a good idea, but yeah. Sometimes supports in your shoes help somewhat. But I would say the best thing is to do some exercise that doesn't aggravate it. So everybody should be doing exercise, but it has to be the right kind. Yeah, well, but there are substitutes for that too. I teach people that. So if you want to learn about what exercise you could do without hurting your foot, I could help you with that. Personalized exercise to improve longevity and health. Well, exercise is good for a lot of things. It improves strength, it improves your endurance, it improves flexibility, your balance. What? Well, you need to find an exercise or get help finding an exercise. Chair yoga is a good start. Okay. So it needs to be enjoyable. It needs to be something that you do and that's personalized. So the positive benefits of exercise equals a longevity pill that doesn't exist. There's no pill that's going to substitute for exercise. Everybody's got to be moving a little bit, as much as you can. Okay. And there are lots of side effects of excess weight. So getting down to a more ideal weight is really important too. You're carrying around more weight, that's inflammatory. Every fat cell in your body is pouring out inflammatory hormones. If we can make those cells smaller by eating right and getting down to a more ideal weight, that would help. Yeah, that's part of it. Very, very much. Those are the 2 most important things, actually. Pillar number 3, stress. So stress and pain reduction is really important too. This is something that I gave you that you can start to practice. It's called diaphragmatic breathing for stress reduction and relaxation. You get stressed sometimes? Either of you? Yeah. Okay, good. It's really something to practice regularly. Ideally, at least 5 breaths 5 times a day is really a good practical thing to do. Either of you take blood pressure medication? You do. So your blood pressure will go down 10 points if you do this for about 2 weeks. You'll notice that you don't need the medication as much or as much medication, but you got to do it. Okay. Stress is mental, chemical, and physical. It's not just in your head. And pain reducing methods are very, very important. So if you're having pain, you want to try and reduce it and not cover it up with pain medications. They're very harmful. They cause lots of trouble and even death. 60,000 people were really, really killed by opioids yearly when they were used indiscriminately. There's a technique I use that's called the Graston technique, and it's a massage that gets rid of the injuries that you have and the scar tissue from those injuries. It can make you feel better within a short period of time. Anybody ever have acupuncture? No. So we do it in 2 different ways. It can be done with needles, and it's not painful. It's very, very painless. It's really like a mosquito bite almost. That's about it. And then it can be done. I brought one of my tools in here, which is this device here. You can see it there. We took a picture of it, and it's electrical acupuncture. And all it feels like is a little tingling. And it really is a substitute for needles, and I use it almost on every patient. Okay. Symptoms of stress. Look at these. Almost everybody has some of these because 90% of all doctors' visits are in some way related to stress. And if you're going to the doctor because of any of these things, the best thing is to try and reduce your stress. You can't get rid of stress, but you can make yourself, I'd say, you can balance the stress. If you do more healthy things, then the stress doesn't affect you so badly. Eating healthy, exercising, doing some breathing exercises, all of those things could reduce some of these harmful problems. So if you go to the doctor and you go to a surgeon, 42% of people that see a surgeon have surgery. 1.5% of patients that see a chiropractor first have surgery, but 42% will have surgery because that's what they do. That's their tool bag. And my tool bag is finding alternatives to surgery. Tip number 4, either of you have problems sleeping at all? Yes? Okay. Sleep is really important. So if there's anybody who wants to age faster, do either of you want to age faster? No, I don't think so either. That's good. So one way to age faster is ignoring sleep problems. And the solution to sleep problems is not drinking more alcohol or taking some medications that are sleep inducing, like Ambien or Lunesta or Tylenol PM or NyQuil or any of those things that really knock you out. That's not the answer. Get rid of the cause. The cause of sleep problems is usually related to stress in some way. What happens when you sleep? When you're asleep, your body is in restore mode. It needs that time to clean up the waste that you manufacture during the day. Sleep allows your organs, brain, and tissues to repair and balance your hormones. If you don't get at least 7 hours of sleep, you're increasing your risk of death for your age by 24%. So I would say sleep is very important. Good. How are you doing with that? Well, I think that you know, well, I think it's important to not ignore it. It's really important. It's really important. So, okay. Anybody sleep on their back? Sleep on your side? Sleep on your stomach? No. Don't sleep? Raise your hands. No. No. So I would say one of the most important things that I do for people is help them with their sleep. It really, really is. You can't feel as good as possible. You can't have the energy you should have. You don't repair your body. Yeah, it's very important. Your watch is telling you the truth. Now, your watch is telling you the truth. You need to do. Yeah, you need to do something about it. Okay. So I'm sure you've been to the doctor and they've given you some blood tests. These are some tests that I do that are beyond what your traditional doctor does. And they're in order to figure out the cause of a problem. I consider myself like a detective. Instead of just figuring out what you have, again, I want to figure out why you have it. It takes more time. It takes more of a team effort. It's not just giving you something and saying good luck. Why did my doctor tell me about some of those tests that I had there? Because it's not part of their training. Their training is to really give you medication. Why? Because most are trained to prescribe medication, and what I'm telling you doesn't require medications instead of medication whenever possible. In order to get a different result, you have to do something different. I call this the pill head. So you said you're taking some medications. The pharmaceutical industry does not create cures, they create customers. You understand what I'm saying there? It really wants you to be addicted to the medication. It wants you to be on it for life. Yeah, it's not getting rid of the problem. It's just really masking it. So it's time to do something different. Don't you think? Yeah, it's time to so if you're tired of a pill for every ill, you've got to do something different. Why do some approaches not work? Is because they're incomplete. It's like a puzzle piece that you're missing. You're not doing some of the things, you've already mentioned, you don't exercise enough, you don't eat as well as you should, you don't sleep as well as you should. Those are some of the pieces to your puzzle that needs to be filled in. It's incomplete. You're not taking care of yourself as well as you should or could, but you need help. It's not that simple. So the program that I call Restoring Your Health program includes a doctor like myself determining what the cause is, creating a unique plan, educating and empowering you, guiding you through your journey, encouraging you, celebrating when you succeed. So I'm very stubborn. I'm a stubborn doctor. I want to make sure that you succeed. I'm not happy if you don't succeed. I want you to get better, and I don't let up. If you want results, I'm there for my patients as long as they need me, and to give them the encouragement and the celebration when they finally do get to their goals. I have had patients with all sorts of problems. This is a lady who was 65 years old and had menopausal symptoms for about 15 years. She didn't know what to do for them. She had vaginal dryness, frequent urinary tract infections, and pain. The symptoms improved tremendously in about 8 weeks after having these symptoms for 15 years when she started to see me. And our approach was to give her a balanced diet, a hormonally balancing diet, supplement for her glands that had to do with stress, a supplement for her immunity, and a cream based on blood testing and stress reducing activities like yoga, exercise, and meditation. And all of those things together helped her tremendously. Another person came to me looking for help because he was feeling tired and lack of energy. He felt like this for 4 years since having 2 children. He had children when he was pretty old, when he was about 50. So his poor eating habits turned out to be the cause. He couldn't blame it on his children. It wasn't really his kids that were doing it. And what I found was his eating habits were terrible, and he feels like a changed 54-year-old man who now has the energy and desire to exercise more, to manage his 2- and 4-year-old children. The advice, counsel, and guidance that I provided him, he says it was priceless. He knew how much it was worth. So we order the right tests, we determine the cause, we focus on the cause, not on the symptoms. And you can reduce the harmful effects of stress. You can learn how to eat healthy for life. You can reduce your pain naturally. You can live longer and healthier. This is what you could do. This is what could happen. There's hope. You don't have to give up. And so everybody needs a coach or somebody who's going to know what to tell them to do. So I always give everybody who comes to one of my presentations an opportunity to do something about their health problems. And so to find out how you can live a longer, more pain-free life, education is one thing. So today I'm giving you an education, a small education. There's a lot more to teach, but you also need to do something. You have to take some action. You can't just go home and do the same things you're doing. So you have to do something about it. And so what we do as a team and what you can expect is that I take it very seriously. I schedule a 1-hour consultation with somebody to make sure I know exactly what the right things are to do. And that 1-hour consultation gives me information about what the right things for you to do to get healthier, live longer, be happier, overall, get down to a more ideal weight, and really enjoy life for as long as possible. So scheduling a comprehensive 1-hour consultation. You'll have the opportunity to do that with Jillian today if you want. Normally, I mean, how many times have you been to the doctor and he spent an hour with you? Have you ever? It's rare. I mean, they are on a schedule. Huh? Sometimes, and it takes, but it's usually a very special appointment. But this is what I do before I start with the patient to make sure I can help them. So I take an hour, I have you fill out some paperwork that gives me more information than I'm getting here today. And we try to solve your health problems if I can. If I can't, I'll tell you that too. If I can get you feeling better and it's something that you're concerned about, I'll let you know. If I can't, I'll say, you're doing the best that you can, or I'll refer you to somebody else. But the cost is $95 for that visit. Normally, it's $395. But because you can come to my talk and I educate you, at least we don't have to go through this stuff in my office. We can do more about what's wrong with you in particular. And it's valid for a couple of weeks after this date. After that, I can't honor it for $95. But if you do schedule an appointment with Jillian today, then it would be $95 for that visit. And this is what we do. We screen you for stress. We look at your posture. We test for undetected nerve damage. We look at your diet, measure your percentage of body fat. We do a scan of your feet. And then I give you a plan to address your health concerns, including the cost. And that's your first visit in the office can also be, some people don't want to come to the office. I do things by telemedicine also. So we can do things on the phone if you can't travel. So if you'd like, there's an envelope in the back that Jillian has and some times that you could schedule an appointment if you wanted to. And then I would say I'd be glad to help you. Any questions? I know you're on a tight schedule. Yeah, well, thank you.